How to manage anxiety without stressing out. Stress and anxiety are not always bad. Stress actually provokes us towards being an alert for when danger occurs so that we can flee for our lives. It also can challenge us towards doing things that we don't want to do that will push us towards excellence. Now, the problem is when it becomes so overwhelming that it's affecting our daily activities in life. We're always in a panic mode. We're always in this rational fear. We're always panicking. That is when it becomes a problem. Please stay tuned. We're going to discuss further. Hi there, I'm Dr. Babs. Welcome back to another episode of the Health Exchange Chat Room at Living at Your Finest with Dr. Babs YouTube channel. I'm a board certified family physician. I'm the founder of Living at Your Finest company, a health and a fitness coach, and I am truly honored and pleased that you are here. Thank you so much for watching my videos and investing in your health. Your support is greatly appreciated and is needed for us to grow our community of health champions. So please, if you don't mind, do me a favor, 3 S's, subscribe, share, and leave a statement. Thank you in advance. It's time to go into the Health Exchange chat room. In this week's Health Exchange Chat Room, my longtime darling friend, Yetunde Jonathan, joins me to debunk all things related to stress and anxiety. She's a senior engineer, mother of 3, and a woman of God. Once we're through with our chat, I will follow it with a deeper dive as I review just what stress and anxiety is. We'll look into what those risk factors are. How do patients that have anxiety, how do they present? I will talk a little bit about complications and how to diagnose anxiety. And we will conclude with just management, whether it's preventative management, whether it's just treatment modalities. And of course, I'll take a question from my guest. So welcome, Yetunde Jonathan, to the Health Exchange chat room.
Dolapo, I'm honored to be here, and I'm super proud of the good work you're doing. And to all our viewers, I want to say welcome, and I hope that this will be a very enlightening episode, for you, and you will learn a whole lot of things by God's grace.
Amen. Thank you. You see, I said she's wonderful, isn't it? See, she's already, and her heart is always to help people. So I appreciate her dearly. So let's jump right into it. So
let's shoot.
This month, April is a stress awareness month, and there's stress everywhere. Just being in the world is stressful as it is.
It's stressful. Yeah, you can say that again.
Yeah, we thank God though that the Bible does say that, but be of good faith that as we have overcome the world. So even though we live in a stressful world, we need to be of good faith. But I'm curious in terms of what you know about stress generally. What brings it on, and how does it lead to anxiety? Do you have some thoughts about that?
Yes. Like I know that every day comes with its own stress. Even the Bible says that sufficient for every day is his own stress. So just count on him, depend on him, take it one day at a time. So the fact that it's a new day, it comes with its own new stress, So I know that stress is something that we encounter on a daily basis. For men, for women, even for children, everybody encounters their own fair share of stress. For me, stress is something that takes me out of my comfort zone. That is stress. Anything that takes me out of my comfort zone, maybe I want to lie down in bed and have my duvet over my head, but I have to wake up and go to work and drive to work and face some other crazy drivers on the road. That is stress. So for me, I believe that for everybody, we have our own fair share of stress, whatever takes you out of your comfort zone,
Yes.
can be classified as stress in my own dictionary. And going back to your question, when does stress become anxiety?
Mhm.
I believe that for something to make you feel anxious, it has pushed you beyond the limits that you can endure. Just everybody has their own elasticity limits. So by the time the thing is pushing you beyond the elasticity limit, it has become an anxiety. For me, that's my own layman understanding of stress and anxiety.
Yes, I agree. And you said it perfectly. When you go out of your comfort zone and it affects your daily being, it's just the thin line between stress and being anxious,
Yes,
and it
exactly.
affects your totality. So absolutely right. Thanks for sharing that. Now, can you speak to some of those symptoms? So we know what it is, but how can one tell based on the way we are feeling that, like maybe, are you having
Okay.
chest pain? Are you having palpitations? So, what are some of those things that you have heard or maybe experienced that you would like to share?
Okay. Most of the answers I'll be giving are somehow related or relating to my life, because like I told Dr. Babs when she contacted me about it, I was like, I'm somebody that has had our own fair share of stress, and at some point also anxiety. Anxiety for me can be more aligned with things that are like phobia, you know, things that are more to me like my fears.
Mm-hmm.
Like for instance, I don't like to travel alone, or I don't want to be alone. At the end of the day, when I'm now having to face it alone, I feel stressed. Like I told her, there was a time I told her that to travel on my own on an international journey is not something that I really, really, feel comfortable with. And by the time I am looking forward to that journey, I begin to experience various kinds of anxiety, and for me, at that point, stress is quite different, or it's different for me, than when I consider anxiety. Anxiety is having more to do with my fears, or something that I really, really have a morbid fear for. I don't want to do this thing, or I really don't. I don't just don't feel comfortable doing it at all.
Right.
For stress, you might even still be okay with it, as in
Mm-hmm.
it's at a mild level, but you find yourself still, surmounting it. For instance, say at work, you have deadlines to meet and all that. There are normal things that you do, but now when it is enormous or overwhelming, you are
Yeah.
stressed. But when you talk about anxiety, it's a different ball game entirely. For instance, I used to have anxiety concerning driving.
Right.
Once I get into the car and start the car, I start, um, I don't know how to describe it now. I start letting out gas from my mouth.
Okay. Burping? You mean
Burping,
like burping?
exactly.
Okay.
I
Okay.
can, if it's a 30 minutes journey, I can find myself burping throughout the whole 30 minutes journey, because it's
Wow.
really something that I'm anxious about.
Mm.
Some other times it is an increase in my pulse rates
Mm.
at such a time, that makes me know that this is what I am experiencing. As for stress, it might just be tiredness. Oh, I'm just so
Okay.
tired, or have a slight headache, and that will be the end.
Okay. Yeah, and those are clear symptoms that you just described. They're different from one person to the other, but it's important that
Exactly.
we identify what they look like and what they feel like, so that you
Exactly.
know that, okay, something is happening. This is not normal, because nobody should ever
Mm.
feel that it's normal to continue to cope with those kind of
Hope,
symptoms,
yes.
because having it over a
Mm.
long period of time can be
Mm.
very damaging to the body. So thank you for
Mm.
sharing your own personal experience. Now, I
Yes.
have one last question before I give you an opportunity to ask me
Okay.
questions, just to this bulk, whatever myths that are out there. So my question for you is, what do you do when you're stressed? Because, you are a high
Oh.
level professional, woman of God. Can you share with us some of your tips that you have done that has helped you, whether it's going from just regular stress to
Okay.
being anxious, that
Okay.
has helped?
Okay, I am being my friend of over 2 decades. You know that that's one of the things that I've really managed and tried to do with my life. When I'm stressed up, I try to take things easy. I'm deliberate about taking things easy, knowing fully well that I am stressed about a particular thing, you know. Some people manage stress wrongly because they start eating arbitrarily because they feel, oh, I'm so stressed up. They start eating chocolate, they start eating this. I'm not that kind of a person. I am just intentional and deliberate, and I just slow things down, knowing fully well that the train is moving too fast for me. So I try to slow things down. I try to speak to myself, just calm down. You've got this, you can do this. Now, if it's on the other side of the divide of anxiety, I take deep breaths in, hold my breath. I take deep breaths in. Also, a level of essential oils. I was introduced to that some couple of years back by a good friend of mine. Essential oils like lavender, ylang ylang, but my favorite is sweet marjoram. I just apply it around my temples, my neck, or my hand, rub it together and breathe it in, and it works wonders in calming me down. Another thing that I do that the Lapo knows is I save up money and go for a trip if I can. Just get out of the environment, breathe in some fresh air. Another way again that I coped with driving, when I spoke with my physician, then it was like, look, madam, driving is something that you cannot run away from. You have to go from one point to the other. So why don't you make it enjoyable? So that's another thing I do. Whatever it is that gives me anxiety, I try to, see the pleasure in it. Right. So you see me now, I've now become a radio junkie. I switch on my car is tuned on. The next thing I do is to reach out for the dial station, and I look for a station that will, accompany me during my drive, takes my mind off it, and I'm able to relax. And before I knew what was happening, that became a thing of the past, Initially too, I would like, okay, are you going my way? Maybe a friend, I'll take a walk, down to the ATM machine. But that's not that I can't always live my life off people. I just had to, basically, I had to speak to myself. That's the bottom line of where I'm going to. I just had to speak to myself that, look, babe, you can't keep doing this. You just have to put yourself together. See, you do it one time and come back. You see, nothing happened. Nothing happened to you. You're good. You're all right. Everything is fine. So for me, those are the ways that I deal with stress and anxiety in my life. I talk to myself. I'm deliberate about things. I look for one or two things, exercises, breathe in, breathe out, just to help me and calm me down. I'm also somebody that was given to panic attack for a long time. But with those essential oils and the breathing mechanisms that I tried, it really helped. And I also spoke to myself to stop doing that nonsense.
You have been such a blessing sharing your own perspective, because it's so important, the positive affirmation, the essential oils. I love essential oils too, because just like you, I've also had my fair share of stressful events that lead to anxiety. And, there's a role for the deep breathing. Oh, it's so therapeutic when we go from the sympathetic mode of anxious to parasympathetic mode. You breathe in and out and let consciousness. So you have really blessed a lot of people by just sharing this. And there are other treatment modalities which I will dive into when I go into the discussion room, because there could be some people that need supplementary like medication or what's not, but we'll dive into where that is appropriate. So I want to give you an opportunity. Do you have any questions that you would like for me to debunk when I go into the discussion room?
Okay. For me, I am somebody that I try to equip myself with every knowledge that I need to get in order to get out of a tough or a naughty situation. But I would really like to know, there's this notion that yoga is not something that, especially for we Christians, we are like, yoga is demonic, is this, is that. I really want to know. I really want to know if it's okay to go that way. Aside that, I think that's really the main question I would like to, because I've actually given myself too much studying of things to do. Another thing, again, I think, just to go back a little, is if each and every one of us can get, you introduce me to the Fitbit wristwatch. Yeah. That way you can always check your pulse rates. You will know if you are going overboard and take your, and slow down the train. So I think there are a lot of it around, not necessarily Fitbits, but you can use to measure your heart rate to know when things are going a bit overboard. I think that's the question I have to ask. Is yoga demonic? I really like
because yoga has been shown to help with anxiety and stress. So I can see how that is an appropriate question to ask. And believe me, I had concerns about it because I am yoga certified, but I am the Christian yoga certified because there are different versions of it. And I will definitely do that. And
we would really like to know the Christian aspect of yoga.
Yes.
So we don't have demons knocking on the door.
There's a background to things. And I think that's where Christians hold on to the voodoo part of it. But yoga is really just a form of movement, and move your body, relax your body. But the theology is, I think, what Christians stand, they hold on to and think that is absolutely demonic. But I appreciate you for bringing that question up, and I'll make sure I emphasize it because it's one of the treatment modalities, just yoga and meditation. And so thank you for bringing that up.
Thank you so much for having me. I really had fun.
Thank you so much. All right, bye-bye. Anxiety disorders are the most common mental illness in the US, affecting 40 million adults in the United States ages 18 or older, which is about 18.1% of the population every year. Anxiety disorders are highly treatable, yet only 36% of those suffering receive treatment. Why is that? I mean, people with anxiety disorder are 3 to 5 times more likely to go to the doctor and 6 times more likely to be hospitalized for some psychiatry disorder. So you can see that it's quite rampant. Anxiety disorders develop from a complex set of risk factors. So it could be genetic, it could be just brain chemistry, it could be personality issues, life events. There's just so many risk factors. And there is a correlation between anxiety and depression. So we definitely have to look out for these. This month, April, is Stress Awareness Month, and that's why I decided that I needed to talk about this, because I've had my fair share of stressful episodes. Life is already stressful as it is, as you heard my guest and I speak about, and we need to learn how to manage it. If not, it's going to manage us, and that's not the case. That's not what we want. So how is stress related to anxiety? Everyone experiences it at one point or the other. The difference I want to stress here is stress is a response to a threat in a situation. Like if a lion came in here, everyone would flee for their lives, right? And that's because the cortisol level in our body, in our adrenal glands, it's yes, we need to do something. So it's a response. The cortisol level tells us, hypes us up, gets the heart rate up, does all the necessary physiological changes that needs to occur for us to take action. But when we have high levels of cortisol over a long period of time, it leads to anxiety. So that is that stress factor that is there persistently, causing all sorts of emotional and physical problems. So that's the difference. Stress is short-lived, anxiety is long-lived, and it causes a lot of cognitive impairment problems. What are some of those risk factors? Let's talk about them so that we can identify them. So unfortunately, it could be as simple as just a life event. Like when you're getting married, a new baby. It seems to me that life generally gives you good stuff, but it also gives you the good and the bad and the ugly at the same time. So having a new job, moving out of town, having a baby, unfortunately some, sad events, loss of a family member. I know I was very, very stressed last year, January, when I lost my dad, and all the way to when he was buried in March, and just so many other life events that tend to happen that seems to be inevitable. So those things those are just physiological things, life events that can lead us to be stressed, and unfortunately, if it's not well controlled and managed, can lead into anxiety. Other things, drugs and medication. So just even prescription drugs. So like albuterol that people use for congestive, for what we call COPD, like lung problems or asthma, other medications that also can do this as stimulants. Sometimes you would take a cough medicine that has a lot of stimulants in it, can lead to palpitations. Some diet pills can actually lead to anxiety and just having a lot of palpitations. Caffeine has been known to do the same thing, give you this mood of always being anxious. And also illicit drugs, unfortunately, cocaine, even alcohol sometimes gets you all riled up. I avoid alcohol by all means because it gets me all riled up. Just a very little bit of it, even though ladies can have at least one glass, I just can't touch it because I just get all riled up. Now, what other risk factors are there? Stress and anxiety related disorders, and there's so many of them. Let me mention a few. Like, for instance, if you have generalized anxiety disorder, that is a very, very common anxiety disorder that is characterized by uncontrollable worrying. You always think something's going to happen, pending doom. You always feel like you're in the middle of some uh, blow up. Panic disorder is also a very common one, and this is where you just have extreme fear of of pending doom. So your heart is beating, racing very fast, you're short of breath. That's panic. Now, there's what we call post-traumatic stress syndrome or post-traumatic stress disorder. This is a condition that causes like flashbacks. So unfortunately, you've had like a really traumatic, life. Maybe if you're in the army or just a lot of crazy things, like maybe if you got boggled or in a car accident. Flashbacks can also cause some form of anxiety. Social phobia, you heard my friend talk about just being in the vehicle, always afraid something is going to happen. I remember I used to always be afraid just being in the car, wondering if I was gonna have an accident, because I was told growing up that everybody around you that is driving is just crazy. So you're the only sane one, so you need to be on alert. So that can cause fear. I am afraid of drowning, so it affects how much I want to swim. I don't particularly like the water as much because I'm not the best swimmer. So it could be social, it could be a phobia of one thing or the other. Some people have social phobia, which is a real thing. They just can't be in crowds. Or it's obsessive compulsive disorder. If you've heard of that, there's the people that do things repeatedly. They have the compulsion to always check and make sure that the stove is off or that the room is thoroughly clean. So these are examples of different risk factors, whether it's medication, whether it's life stresses, whether it's disorder. They all lead to some form of stress, stroke, anxiety. Now, what are some of those symptoms that will give you an idea that this is anxiety, this is more than just stress? So you could have stomach ache, muscle tension, you just feel uptight, you're breathing really fast, sweating sometimes, you just don't feel like eating, you're not sleeping well, you're fatigued. So these can be an interchange between stress and anxiety. Definitely when you're having this over a long period of time and it's just not getting better, you're just not concentrating as well, you're just restless. These are not things that you should take lightly at all. People who have stress and anxiety over a long period of time may experience negative related health outcomes. I'm going to be talking about some of the complications now. Heart disease, high blood pressure, depression, panic disorder. All of this just occurs due to the overwhelming levels of cortisol that can affect the vessels. A lot of imbalance of the hormones can lead to depression and panic disorder, and just inadequate sleep, of course, indirectly affects the blood pressure, affects the way the body functions. So these are some of the complications and much more. Unfortunately, there's no test per se to diagnose anxiety. It is a system of elimination. So you take a thorough history, you do a physical examination. You always want to rule out medical causes. So for instance, you want to make sure that there's no thyroid problems, because thyroid sometimes can present as anxiety. So a lot of heart problems, heart palpitations, chest pain. You want to make sure that there's no any other medical conditions that could mimic itself as anxiety. You have to do a great quick medication review, make sure that that's not happening. So pretty much other than those basic labs that you're going to do for thyroid and make sure that there's no other underlying problems, there's not a specific test that will diagnose anxiety. How do we manage anxiety then? How do we take care of it? There's several preventative measures that is used to manage a stressful situation. So lifestyle changes, coping mechanisms, and there's so many of them, and I'll list a few now. So definitely good night rest always helps. Self-care, meditation, listening to music. You heard my friend speak about listening to music. That's her companion now whenever she's in the vehicle. Yoga, she asked about yoga. Yoga is also one thing that I use because when I was overwhelmingly stressed last year due to the death of my father, I became certified in yoga because it really helped my mind cool down. Prayer, meditation helps, but yoga is a form of relaxation for both the spirit, soul, and body. And so that is another way. The foods we eat make a big difference. What we eat, how we eat it, when we eat it. Really, if we eat nutritious foods, it serves our body a whole lot better. We get the nutrients that our body needs to adapt to stressful events. If we eat a whole bunch of crappy foods, foods that are not nourishing, being dehydrated, it just really makes it worse. All right, so taking time out for hobbies, doing things that bring joy and pleasure, having a journal, keeping a gratitude journal, things like that. These are all stress relieving habits that definitely help us to manage anxiety or even starting off with stress. Reading is so important. That's a practice that I've also started and I've enjoyed it so much. I'm doing it frequently. My friend also alluded to the fact that just breathing takes you out of that sympathetic mode, fight or flee mode that we're always in. So when we take deep breaths in, we stimulate the diaphragmatic breathing, and that leads to parasympathetic stimulation. So we're at a more relaxed mode. So that helps. And there's a particular breathing method called box breathing. So it's like you inhale for 4, you hold for 7, and you release for 8. Wonderful, wonderful. If you do like 4 sets of that, that helps. Learning to recognize what those factors are and what the triggers also help. Talking to a friend, having your family that you can trust, and just really lay it all out instead of bottling it in. Now, if you have to treat, though, there are 3 treatment modalities. Again, one will be stress relieving mechanism, and I listed a few things that you can do that will help to manage stress. Another thing is psychotherapy. Always talking with somebody helps, not bottling it in. So when you talk with somebody, it helps to just let it out. You'll be able to, they say the eyes that see does not see itself. So maybe hearing another person's perspective and not just your perspective. There's a lot of like what we call CBT, which is cognitive behavioral therapy. That can also be very helpful. But if it's so severe or you need something to augment that, there's medication. And most of these medications come in sedatives, so sedatives that will help you calm yourself down, or antidepressants if it's gotten to that stage, or maybe if you're not able to sleep, sleep medications, or just anything that will help to balance the brain chemistry and stabilize just that panic mode that one is in. Now, my guest had a specific question about yoga. So Christians, are we allowed to practice yoga? Is there a taboo about it? So let me be honest. Before I got certified in yoga, I was worried about it because a lot of times I hear people say, especially Christians, oh, it's Hindu or it's Buddha, and it's not Christ serving. And I had to have an open mind. So I had to, first of all, do the research and have an open mind without judgment. And if I was going to disagree, I needed to do it with dignity. And so I found that yoga itself is one of the many complementary as well as integrative practice. And overall, what it does is that it brings the physical and the mental discipline that helps us to achieve peacefulness. All right. And it does it through the movement of our bodies. So even though, yes, the origin was many, many years ago in India, where they were igniting the spirits, but the way I see it, when I'm practicing yoga, I'm practicing with the origin of being a spirit being, because I'm a spirit being, right? Christ is in me, the hope of glory. So I do my movements to glorify God. So for that, I'm content, and there's no condemnation. I see myself being relaxed, making all those movements that help to increase strength and flexibility. It helps me with my breathing. It helps me with being mindful. So all those things. So when I'm practicing again, I infuse my yoga with the meaning of Christ and glorifying him through my movements. I also make sure that I walk in the spirit and not in flesh. All right. And I know who I serve. My Redeemer is the one I serve when I practice yoga. So I hope that you found value in this video by being empowered to speak up if you're stressed and if you think it's getting into the level where you're just anxious all the time. April, like I said, is Stress Awareness Month. So I think that it's appropriate for us to talk about it and see the correlation between stress, anxiety, and depression. Especially with the year that we've had, it's been rough for all of us. So what's your takeaway today? What are you going to do different? How are you going to minimize the stress events? We can't do much about that, but we can manage the way we respond to it. For me, I'm definitely going to do more breathing work because it helps me. It might be uncomfortable initially, but the more you do it, you get more at ease and you're no longer in the flight mode. So you're more in a relaxed mode and you create a stressless environment. Thanks so much for staying to the very end of this video. I hope that you found value in what has been discussed so far. You've been empowered to speak out. If you're stressed, or if you're having an anxiety attack, or you're just having some major setbacks, please speak out, seek help, all right? April is Stress Awareness Month, especially with the year that we've had so far with the pandemic, all the stressful events. Please speak out. Don't go through it alone. We're healthier together when we help each other and we encourage each other. So until next time, I want you to remember that you can become a health champion because you need to, you deserve to, and you most certainly can achieve to live at your finest. Holistic health. Have a lovely, lovely week. Take care. God bless and much love.